All models are packaged with some light assembly required. This is to ensure that damage does not occur during shipping. To attach the arms, push the arm toward the shoulder of the mannequin with the keyhole aligned. And with the keyholes aligned, bring the arm to a normal position. These instructions may be followed to install both the plain arms included with the basic, complete, or advanced Lucy, and the blood pressure and IV arms that are included with the advanced version only. To prepare the injectable training arm for use with Lucy, prepare the synthetic blood as instructed in the instruction manual. Before filling the IV bag, be sure the clamp on the IV tubing is closed. This will be IV bag A. Fill 500 cc's maximum. Be sure to hang IV bag A no more than 18 inches or 45.72 centimeters above the level of the arm. Attach the tubing on IV bag A to one of the shoulder tubes. Since this is a single tube loop system, it does not matter which tube you use. This will be now the inlet tube. Use a second shoulder tube for the draining. This will be the outlet tube. With the outlet shoulder tube attached to the second IV bag, we will call this IV bag B. Make sure the clamp is on the drain tube is open. To flush the vascular system with a synthetic blood, slowly open clamp A on IV bag A. Allow the system to flush with synthetic blood until the air bubbles are no longer seen passing through the outlet shoulder tubing into the IV bag B. Turn the arm over to force any remaining air bubbles out of the system. Close the clamp on the outlet shoulder tube, and if using an IV bag, close off the blood outlet. The system is now filled and pressurized. Be sure to leave the clamp on IV bag A open. The arm is ready to practice drawing blood. Synthetic blood can be drawn anywhere along the pathway of the vein. The left blood pressure simulator arm has digitally recorded blood pressure sounds that can be varied by pulse rate and volume. The different cough phases can be identified, and an optional oscillatory gap can be selected. A palpable radial pulse is present in the wrist. To set up the blood pressure simulator arm included with the advanced Lucy maternal simulator, install the batteries in the back of the blood pressure control unit. Install 6 AA batteries as indicated by the orientation diagram embossed in the bottom of the bracket. After the batteries have been properly installed, reassemble the electronic control unit by sliding the compartment closed. Turn on the electronic control unit by pressing the power button on the top right of the unit. Observe the display and verify that a readable display is present. Please note, the control box has a battery saving feature that will turn the unit off after approximately 8 to 10 minutes of no keys are used within the period of time. To connect the arm electronic control unit and blood pressure cuff, locate the cable that extends from the blood pressure simulator arm and plug into the top of the electronic control unit using the jack labeled ARM or arm. Locate the end of the pressure line attached to the blood pressure cuff that is assembled with a male lure fitting. Attach this end of the pressure line to the female lure fitting assembled at the top of the electronic control unit marked cup. At this point, the blood pressure simulator is ready for use. The unit has been factory calibrated for use with accessories included. No further calibration adjustments are necessary at this time. If the unit is to be used with a blood pressure cuff other than the one supplied, or when recalibration is necessary, see the section titled Calibration Procedures in the instruction manual. To operate the electronic control unit function for the blood pressure arm, you will see that under the display window there are 3 buttons titled Menu, Gap, and Calibrate. To set the systolic and diastolic pressure, press the menu key once. The Set Systolic Pressure menu will display the electronic control unit window. Use the up or down arrow keys located to the right of the menu button to adjust the systolic pressure. Press the menu key a second time. The Set Diastolic Pressure menu will display the electronic control unit window. Use the up or down arrow keys located to the right of the menu button to adjust the diastolic pressure. The systolic and diastolic pressures can be set anywhere from 0 to 300 millimeters. To set the heart rate, press the menu key a third time. The Set Heart Rate menu will display in the electronic control unit window. Use the up or down keys located to the right of the menu button to adjust the heart rate. The heart rate can be set from 0 to 300 beats per minute. To set the palpable pulse, it is found in the radial location. Palpations can be felt upon startup of the unit or after blood pressure and heart rate settings have been made. The palpable pulse is delicate and should be palpated lightly. Pressing too hard will damage the pulse feature. To set the pulse, press the menu key a 4th time. The Set Palpation menu will display in the electronic control unit window. Pulse on is defaulted. Use the down arrow key to the right of the menu key to set palpation to pulseless. The palpation can be set either on or pulseless. When the pulseless setting is used, the diastolic and systolic pressures will automatically be set to 0. Use the up arrow key to the right of the menu key to set palpation as pulse on. Note that during an actual blood pressure reading, the palpable pulse will automatically turn off when the cuff inflated and surpasses the systolic set point. It will turn on when the cuff is deflated to 20 below the diastolic set point. This function allows students to clearly hear cuff sounds. To set the oscillatory gap, locate the gap key to the right of the menu key. Press the gap key to set the function on Y equals yes or N equals no. When the key is pressed, a message will briefly appear on the oscillatory gap is enabled or disabled. The main display window will show A gap Y or on, or A gap N or off. To set the volume, the arrow keys are controlled volume of the sounds present in the arm. From the main menu, press the up arrow key to increase the volume, or press the down arrow key to decrease the volume. The volume levels can be adjusted from level 1, lowest volume, to level 7, the highest volume. To change the eye color on Lucy, pry the eye out from the upper lid using a paper clip or similar object, such as a small blood mixing spoon provided with the microfilm in the advanced Lucy. Never use a sharp or pointed tool. Pull the eye free from the socket. Add a small amount of the provided lubricant included and pad your finger with the lubricant. Using the lubricated finger, apply the lubricant to the eye socket. Push the new eye under the lowered lid and fit the eye into the socket. Your chest and lung bag. Connect to the trachea tubing with the elbow connector extending into the torso from the attached head. To connect the airway and install the foam CPR chest, slide the lung bag in the pocket of the foam CPR chest. Position the lung bag inside the chest so that the port on the lung bag aligns with the hole inside the chest. The port fits through the foam CPR chest to the back. Insert the trachea tube with the elbow connector into the hole at the top of the foam CPR chest. And finally, connect the trachea tube with the elbow connector to the lung bag port through the back of the foam CPR chest. To set up your simulator for Leopold maneuvers, install the fetus and prepare for delivery simulation. Remove the pelvic block. Attach the positioning bag to the upper port on the inside of the torso. Place the pelvic block into the torso and lay the positioning bag lengthwise over the block. Attach the inflation tubing with a squeeze valve to the upper side port on the outside of the torso. Position the articulating fetus as desired. Lay the abdominal pad over the fetus with the narrow end passing beneath the pubic bone and the edges tucked in around the sides. Attach the normal abdominal skin to the torso. Close the valve on the air pump and inflate the bag as needed to adjust the fetal position within the abdomen. Remember, do not overinflate. The bag can be deflated slightly to enable articulating fetus to drop beneath the pubic bone. To set up cervical dilation and effacement, select the desired cervix module and plug it into the receptacle in the pelvic block. Place the pelvic block in the torso. Position the genital foam stabilizer pad in a U shape between the block and the skin. This will prevent excessive movement of the skin during examination. To simulate shoulder dystocia, lay the positioning bag crosswise in the lower torso and connect the tubing to the lower side port. Attach the inflation tubing with squeeze valve to the lower part on the outside of the torso. Position the fetus inflate the bag slightly. Raising the fetus to the desired position. After the appropriate actions have been practiced, Open the valve on a squeeze bulb to fully deflate positioning bag and complete the birth process. To set up for a vaginal delivery, remove the pelvic block and perineal skin foam stabilizer pad from the torso and install the perineal birthing skin. Attach the placenta to the metal plate on the abdominal wall of the torso. Attach the long umbilical cord to the placenta. Connect a short umbilical cord for clamping and cutting to the long one. Connect the remaining end of the umbilical cord to the fetus. Position the articulating fetus in the abdomen. The abdominal skin may be installed or left off so the instructor has better access to manipulate the fetus. The fetus may be placed in an included clear plastic bag to simulate the amniotic sac. To simulate a cesarean section, it is important to note not to use the abdominal pad in this scenario. Remove the perineal skin foam stabilizer pad and place the pelvic block in the abdomen. Position the articulating fetus on the pelvic block as desired. You may connect the umbilical cord sections and placenta to the fetus if desired. Please note, the placenta cannot be attached to the abdomen with the pelvic block in place. Simply lay it elsewhere within the abdomen. The normal abdominal skin may be left off or used with the lower section folded back. Either perineal skin may be used, the prenatal or birthing. Leave the upper section of the selected perineal skin unbuttoned to accommodate the cesarean skin. Install the cesarean abdominal skin on the torso. The performed incision is specially reinforced and may be closed as desired. Also, please note that repeated suturing and or stapling will eventually damage the skin and the skin will need to be replaced. For postpartum care, episiotomy, replace the perineal birthing skin with the episiotomy skin. Place the pelvic block into the torso and install the perineal skin foam stabilizer pad. The skin will withstand several suture opportunities. The sutures may be left in place for nursing practice. To extend the life of the skin, use a small needle and avoid pulling the sutures too tight. Simulated blood may be added for greater realism. For postpartum care, fundal assessment and massage, attach the fundus tubing to the upper side port and attach the inflation tubing with squeeze bulb to the outer port. Place the pelvic block into the torso. Lay the abdominal pad over the abdomen with the tapered end toward the chest. Tuck the rest of the pad loosely into the pelvis around the block. Attach the normal abdominal skin onto the torso and the inflation tubing to the port on the outside. Adding 3 to 5 pumps of air will increase the firmness. Opening the air valve completely will give the fundus a soft or boggy feel. Closing the valve will result in a firmer uterus. Please avoid overinflating the fundus, as this will damage the simulator. Clots and hemorrhages can be used with multiple scenarios to add realism without the mess of moulage. Durable material will allow for multiple uses with proper care, as described in the instruction manual. The small perineal hemorrhage is approximately 145 milliliters and is 14.25 inches long by 4 inches wide and 0.25 inches high. The large hemorrhage blood pool is approximately 340 milliliters, 12.75 inches wide by 10.5 inches long and 0.25 inches high. The small blood clot is approximately 66 milliliters, is 3.29 inches long, 4.25 inches wide, and 0.86 inches high. The medium blood clot is approximately 107 milliliters, is 3.5 inches long, 4.25 inches wide, and 1.09 inches high. The large blood clot is approximately 193 milliliters, is 5 inches long by 5 inches wide by 1.38 inches high.